We had called her daughter, and she was flying down, and we headed to the airport to pick her up when the heart attack hit me. You know, probably wasn't 30 minutes after I got to the hospital till they was putting stents in. he found while he was doing the other where that I had another artery that was about 80% blocked, so that's what he's doing the procedure today to take care of that blockage, and hopefully I'll go home this afternoon.
The standard approach in doing cardiac catheterizations is through the groin, and it's been around for 30 years, and it is effective, but some of the concerns are bleeding complications. When we do angioplasty and stents, we need to give blood thinners to prevent the stents from clotting. Now there's a new approach which is going through the radial artery, which is the artery in your wrist. We're going to put a little tube into your left radial artery. Through that, we're going to go up to your heart and put a stent in the other blockage.
Good.
There you go.
Basically what we're working on are the arteries around the heart, and these arteries supply blood to the muscle for nourishment, oxygen, and when there's blockages, which is plaque buildup in the arteries, that can impede the flow. The way we unblock or improve that flow is to get a catheter, which is kind of a long piece of spaghetti, a hollow piece of spaghetti, that we slide up through the arteries, up to the heart.
This is the sheath. This is the tube that we're going to insert the work through.
Through that tube, we'd inject some dye.
You might feel some warmth here.
And see where the blockage is. And once we see where the blockage is, we can go and fix it by sliding a little wire through the blockage.
Going up.
Inflate a balloon, and then place a stent, which is a stainless steel mesh that would push the blockage out of the way and improve the flow through there.
Okay, that's it.
The advantage of the wrist artery is that it's very superficial, very easy to control, and plus we can take the tube out immediately and put this little wristband on it to stop the bleeding. When we previously go through the groin artery, usually I tell them to rest for a week. They can walk, but don't resume activities because there is a risk of bleeding from the groin. Presently, I ask patients to resume their regular activities a day after the procedure.
We were really impressed with the hospital, and I'm really impressed with the doctor. If I'd been choosing a doctor, I couldn't have chosen a better one than he was. And we're impressed with the whole facilities here at Parish.